Okay.
Yeah.
So
I have this one already set up, so I'm just gonna kind of briefly walk you through how to do it. So with the syringe, you just want to go ahead and attach the needle. And I'm gonna open it just so I can show you, okay?
Okay.
And once this needle is attached here, you wanna insert it in this little stopper right here. And you're gonna draw up all the way up to the 50. So you're gonna drop 50 mLs.
Oh, okay.
Okay?
Okay.
So we're gonna get this fluid in the syringe.
So the needle first?
Yes. So we're going to attach the needle first, and that's where you're going to stick it in here,
Oh,
and you're going to drop the 50 mLs.
Oh, I see.
Okay.
Okay.
Then you're going to go ahead and detach the needle,
Detach the needle.
and you're going to go ahead and connect. This is called a butterfly catheter. So you're going to connect it right here. And then this right here has a protective cap. So don't take it off until you're ready, because it hurts if you poke yourself, okay?
Okay.
All right. So you're gonna have somebody hold just the way she's holding. So just like one arm like this around the neck, and you're gonna come over here in this area. So as you can see right here, there's some loose skin, and you see how it tends and kind of gets stuck right there. It doesn't go back down all the way.
Oh, yeah.
This usually means that the pet is dehydrated.
Okay.
Okay, so you want to pull it up, and it'll usually just bounce back down. And it's kind of still sticking right there, okay? So we're gonna go in this area. So this little patch right here that doesn't have any fur, it'll probably be easier. So you wanna kind of make like a little tent right there. And this is where we're gonna stick the needle in, okay? So let's put them on the table. If you wanna come around this way. Okay, so then you're going to go ahead and remove the little protective layer. And do you see how the needle has kind of like a little opening right there? You want to go in like this, the opening side up, not opening side down.
Okay.
Okay, so opening side up.
Yes.
So you're going to go ahead and make a little tent right here, and you want to go in the middle. So I'm going to go ahead and stick it in, and it's going to go in there. You see how it's in? They don't have a lot of nerve, so that's why it's not reacting. Then you kind of put the syringe like this standing, and you just want to push it down.
Oh, shoot.
She is going to feel it, but that's just because the fluid is kind of cold, and you'll feel a little bubble. It's more uncomfortable than pain.
Okay.
It's just kind of like, ooh, what is that?
Okay.
And you want to go, you know, at a slow rate. You don't want to just flush it all the way in there, because then the dog is going to freak out a little bit, okay? It's okay, Winky. So it doesn't take long. Good job, Winky. Okay, so now that we're done, you're going to go ahead and pinch it again, right where the needle's at, and just pull the needle out. And you just want to keep it pinched just for a little bit, because sometimes it can leak out a little bit, okay? That's normal. And you'll see, you'll be able to feel the fluids if you want to feel it with your hand right here. Can you feel the fluids? It's like a pocket of fluid right there.
Yeah.
Okay?
Okay.
That's normal.
Okay. When is it gonna be all?
So as the body is absorbing it, it'll go down. So sometimes it can take an hour, sometimes it can take 2 hours. Sometimes it can shift from one side to another. So don't be alarmed if you see like a big pocket in the arm or more towards down the belly. It's normal. It's just in the sub-Q fluids, like in between the muscle and the skin.
Okay.
Okay? So after that, sometimes there'll be some blood, so don't be alarmed if there's blood, okay? That's normal.
I don't have to disinfect the area before the...
Not necessary, no. Hi.
Dog skin are different, right?
Yes, they don't have a lot of nerves in that area, so that's why Winky didn't even flinch. It was more when she started feeling the fluids, yeah.
Should I do it in other areas just so I don't...
So I would probably alternate on the other side, like the next time, and then, again, just so they don't get so sensitive from that area. And I'm just going to get a little bit of peroxide and just clean that up. But other than that, you just want to make sure that the fluid is not leaking out, which it's not. But you can feel it's nice and cool right here. Okay, and then you want to make sure you cap this so you don't poke yourself. And then you're just going to remove this. And this, I'm going to give you one for each one, okay? So you want to use a new one every time that you do the fluids, okay? Because then this becomes dull. You don't want to poke her with a dull needle. Okay.
So new one each time. This
Correct.
one, this is the same.
This is gonna remain the same, yeah.
And the bag, do I have to change that?
Yeah. So I'm
every
gonna
time?
show you. So it's gonna be the needle is just only for drawing purposes.
Oh, okay.
So when you draw it up, I'm just gonna show you really quick. You just stick it in there, and then you're just gonna draw it up
Oh, I see.
all the way to the 50. Okay.
Got it. So that's the drawing needle.
Yes.
And then the drawing needle remains the same
Yeah.
one?
You just remain, yes, because this is just only going in there. It's not
Oh,
going
I
into the
see.
body. So since this is going into the body, we want to use a new one each time.
I see, okay.
So once you detach this one, you just want to just put it back on there with the cap.
Put it back on there?
Yeah.
Okay, got it.
Okay.
Sure.
All right, so you did very good, cutie pie.
Baby.
So I'm gonna go ahead and just clean up with a little bit
Okay,
of peroxide.
Sure.
Do you think you